It was 130 years ago today that Alexander Graham Bell made the first telephone call. Soon people were using the phone to call their doctors, and it wasn't long before doctors were refusing to make house calls. Now, thanks to new advances in communications, they may not have to. Wyatt Andrews introduces you to telemedicine.
5-year-old Diamond Harrell has a sore throat at school today. But the nurse on duty is on TV.
Diamond, how are you?
And Diamond's checkup will happen on the internet.
When did your throat start hurting?
Nurse practitioner Cindy Ten Hoopen is miles away at the University of Rochester Medical Center. As her assistant works the stethoscope, Cindy, online, can review Diamond's heart rate, listen to her lungs, and study pictures of that sore throat.
It's just a little bit red.
It's called telemedicine, and it's the rage in Rochester. 11 daycare centers and 7 schools are connected to the university or to 10 doctor's offices around the city.
Your lungs sounded good, too.
It's another example of the blazing efficiency of the internet. Telemedicine is transforming the time-eating practice of going to the doctor's office because it's eliminating the go-to-the-office part. And who benefits most? Working parents like Beth Barrissey. When her son Jackson woke up with a reddish eye, she brought him to daycare, which has a telemed computer, and she was online with Cindy in 20 minutes.
What I'm going to do is prescribe some eye drops for him.
Is it important that you haven't burned a day of work doing this?
Yeah, certainly. You know, we're both, we come from a two double working family, and it's very important that we don't miss a lot of work.
Telemedicine is not for serious illnesses, it's for the everyday sniffles. And so schools that have it say absences are down 60%.
Parents are readily seeking health care. Instead of hiding a ringworm under a long-sleeve shirt, they'll come right away and they'll say, "Can you do a telemedicine visit on this? I think my child might have ringworm."
It's almost like time travel. While we watched, patients beamed themselves into Cindy's online waiting room. But I beamed in at one point to ask if there wasn't something missing. Do you miss the actual hands-on part of medicine?
I have to say no. I can see the joy in their faces video conferencing.
Diamond, by the way, was fine and returned to class. Jackson, though, had an infection and was sent home, but not before his televised farewell.
Have a good day. Bye, Jackson.
Wyatt Andrews,
Bye.
CBS News, Rochester.
Have a good day.
How time